Welcome to your favorite mental health awareness channel. In today's video, we have brought to you 5 easy tips for managing your chronic fatigue syndrome. Without further ado, let's start. Number 1. Improve your sleep hygiene. Sleep is often disrupted in some way for people with CFS. You may find it difficult to get off to sleep, you wake later in the night, or that you wake not feeling fully rested. Often people with CFS nap in the day to try and catch up on what is felt to be missed sleep, but this can have a detrimental effect on sleep quality at night as the body is out of a normal rhythm. Good sleep habits or sleep hygiene is as important as tooth hygiene or any other type of self-care. You have to be methodological and structured. This then builds good habits and therefore good hygiene. Build and structure your sleep both in terms of trying to avoid naps in the day, but also by planning and implementing a routine before you go to bed at night. This might include not watching TV for 2 hours prior to sleep, having a nice warm bath, practicing some breathing control exercises, and then putting yourself to bed. This order and routine, once established and recognized persistently by the brain, will order your sleep better and enable your brain to recognize it is time for sleep. This takes time, so persist. Keep these new routines going for over 2 months, and you will see improvement in your sleep and in your energy levels throughout each day. Resting 2. Identify your baselines. Baselines are what we term the base level of ability that won't trigger a worsening in your symptoms or a relapse. Your baseline walking tolerance, baseline sitting tolerance, or your baseline tolerance for sewing or knitting will be different as they will demand different levels of energy from you. Knowing these levels ensures that you have control over your condition and know how and when to stop. This ensures you don't overdo it again and again, which can eventually be very demotivating and also detrimental to improvement. A physiotherapist can help you to identify and set your baselines using techniques to assess your current ability levels over a period of time, and then setting the amounts with you for different activities. It takes a bit of tweaking, but is worthwhile putting the time investment into to get it right. 3. Build on your baselines. Once you have established your baselines and have been comfortably living within these limits for some time, it is time to challenge them. These baselines might only allow you to do a small amount of activities that you enjoy or wish to do more of. For example, establishing that your baseline for walking is 3 minutes is excellent for setting your levels and feeling in control, but this doesn't allow you to do the weekly shop or get to the train station in order to get to work. We call this graded exercise or pacing, and it is a valuable tool in treating many chronic conditions such as CFS. It has been shown to improve the quality of life of CFS sufferers, and can be implemented by anyone once baselines have been set. Starting with your baselines and gradually as the weeks progress, you add a very small but regular amount of time or distance to that activity. For instance, if your baseline walking level is 3 minutes, you may choose to add 1 minute every 2 weeks until you reach your desired goal. This has to be performed regularly in order to see results, and getting rid of habits such as variability is vital in order to see results. This can take time and needs planning. You might feel this technique is frustrating initially as it does mean planning your day quite carefully, but once results and improvements start to be seen, it is easier to stick with. 4. Speak to other sufferers. There is nothing like a good bit of support. Whether that's from a medical professional, your physiotherapist, or a fellow sufferer. Each can have tips and pieces on advice that might offer you some alternative way of approaching a problem you are having because of your condition. Open listening, or listening where we fully absorb what the other person is saying without judgment or interrupting them, is an art form, and practicing listening to advice being offered to you is an invaluable life skill even if you don't suffer with CFS. When you do have this condition, it can make concentrating more difficult, so practice focusing on conversations and not allowing your mind to wander. Practice finishing what you are reading to a definite point, such as the end of a chapter or the end of the article, before you allow yourself to become sidetracked by your thoughts. This concentration skill fine-tunes the brain's focus and can have a positive effect on chronic conditions such as CFS. The brain is a highly complex machine, and we still do not fully understand the working of a normally functioning brain, whatever that may be, let alone one suffering with CFS. What we do think is that concentration practice and focused learning can bring the attention away from the detrimental condition and back to normal activities, hopefully adding to improvement. 5. Try alternative therapies. There are numerous alternative therapies out there for CFS, including osteopathy, energy treatment, acupuncture, homeopathy, and herbal remedies. Everyone reacts differently to these types of treatments, and none can claim to be cures. However, if you choose treatments based on sound research combined with recommendations by friends and family, they may help. It's also worthwhile checking the National Institute for Clinical Excellence guidelines for current recommendations. Don't be persuaded to hand over lots of money up front for long treatments before. See if you feel any benefit after a few sessions, and always try to combine these more passive treatments with active strategies as discussed above for best results. Thank you for watching. Please don't forget to subscribe to our channel to be notified each time we upload a new video. Thank you.